Moving on to next case. A 38-year-old woman presents to the OPD with complaints of recurrent epigastric pain since 2 years, which was dull aching in type, radiating to the back, aggravated by taking fatty meals and relieved on painkillers and rest. She had previous history of admission to a nearby hospital 1 year back, for which she was managed conservatively. She also gives passage of fatty clay colored stool, that is, this is basically steatorrhea. On examination, vitals were stable. Abdominal examination revealed umbilical tenderness. Ultrasound and CT were taken to confirm diagnosis. So what is the most probable diagnosis in this case? Well, this is a case of steatorrhea, and steatorrhea may occur when there is deficiency of lipase enzyme. Basically, steatorrhea is presence of excess fat in stools. So stools become fatty, bulky and frothy. So this excess fat in stools may occur when fat is not digested and is not being absorbed. So that may be due to deficiency of lipase enzyme, or there may be decreased bile in intestine, because we know that bile is important for fat digestion as well as absorption. But given this history that it is a dull aching pain which is radiating to the back, this happens when there is a pancreatic disease, since pancreas is a retroperitoneal organ and its pain basically radiates to the back. So this points to disease of the pancreas, and since it's a chronic disease since 2 years, and there is also a history of admission to nearby hospital 1 year back, so everything points to the diagnosis of chronic pancreatitis. So let's try to solve various other questions based on that what is the characteristics X-ray appearance in this condition, what is steatorrhea, what are the factors influencing the secretions from the affected gland, that is the pancreas in this case, and how about the treatment of this condition. So in this case of chronic pancreatitis, characteristic X-ray finding is a string of pearls appearance. Basically what happens that in chronic pancreatitis there is obstruction of pancreatic ducts at varied intervals, and this causes dilatation of ducts backwards from the point of obstruction. So there is alternating dilatation and obstruction which appears as string of pearls appearance. Then next question was on steatorrhea. Well, steatorrhea, as already told, is passage of fatty bulky stools, and in this case it is occurring due to exocrine pancreas deficiency, causing deficiency of pancreatic lipase enzyme. And because fat is not being digested and absorbed, there is continuous loss of fat, so this is also associated with weight loss. But remember that this steatorrhea may also be associated with a condition in which lipase is being secreted into the intestine but it is not able to act. So that happens when there is excess gastric acid coming into the duodenum, thus decreasing the pH in the duodenum, and lipase needs alkaline pH to act. This pancreatic lipase needs alkaline pH to act. So in the presence of excess gastric acid, this lipase which is being secreted will not be able to act. Secondly, if there is deficiency of bile, as in case of ileal resection, what happens that there is a decreased enterohepatic circulation of bile, and this also causes steatorrhea because not adequate bile is secreted from liver into the intestine. Next, what are the factors which influence pancreatic secretion? Well, there are hormonal factors and neural factors. And in hormonal factors, there are two gastrointestinal hormones, that is cholecystokinin CCK and secretin. Cholecystokinin is responsible for mainly increase in pancreatic enzyme secretion, while secretin is responsible for increase in watery alkaline secretion of pancreatic juice. So CCK acts by activating phospholipase C and hence increasing calcium concentration. On the other hand, secretin increases formation of CAMP and increases pancreatic secretion. Then Neural mechanisms include the autonomic nervous system, that is parasympathetic and sympathetic, where parasympathetic activation increases pancreatic secretion while sympathetic activation inhibits the secretion. Now, coming to treatment of this condition, well, you see, the most common cause of chronic pancreatitis is the chronic consumption of alcohol and the presence of stones in pancreatic ducts. So basically the treatment is targeted for that. So a person has to be told for stopping smoking and alcohol, and if there is presence of stones, then endoscopic stone extraction via ERCP can be done. On the other hand, for decrease in the enzymes which are there, pancreatic enzyme supplementation is done, and for relieving the pain, NSAIDs, that is non-steroidal anti-inflammatory drugs, can be given.